What is the main reason for using deep hypothermia, rather than moderate hypothermia, in some cardiac surgeries? A. It prevents postoperative myocardial infarction. B. It improves pulmonary compliance. C. It allows for a bloodless and motionless surgical field with full circulatory arrest. D. It reduces postoperative pain. Answer: C. It allows for a bloodless and motionless surgical field with full circulatory arrest. Explanation: deep hypothermia enables safe circulatory arrest, which provides a bloodless and motionless field, critical for complex procedures like aortic arch reconstruction or certain congenital heart surgeries. Which of the following physiological changes is typically seen during deep hypothermia? A. Increased enzyme activity. B. Increased heart rate. C. Decreased cerebral perfusion pressure. D. Decreased oxygen consumption. Answer: D. Decreased oxygen consumption. Explanation: hypothermia slows cellular metabolism, leading to a significant reduction in oxygen consumption. This is essential during DHCA to protect vital organs, especially the brain, from ischemic injury. Which of the following factors most significantly influences the safe duration of DHCA? A. Mean arterial pressure. B. Depth of hypothermia. C. Type of cardioplegia used. D. Hematocrit level. Answer: B. Depth of hypothermia. Explanation: the depth of hypothermia directly influences the reduction in metabolic rate, thus determining how long tissues can safely tolerate circulatory arrest. Lower temperatures extend the safe window for DHCA. Which pharmacologic agent may be administered before DHCA to enhance neuroprotection? A. Dobutamine. B. Mannitol. C. Lidocaine. D. Thiopental. Answer: D. Thiopental. Explanation: thiopental, a barbiturate, is used to reduce cerebral metabolic demand and offers some degree of neuroprotection. It is often administered prior to DHCA, along with other strategies like cooling and steroids. Which of the following is true about retrograde cerebral perfusion, RCP, during DHCA? A. It involves perfusing the brain through the femoral artery. B. It is the most effective method for full cerebral protection. C. It is delivered through the superior vena cava. D. It increases intracranial pressure and is avoided. Answer: C. It is delivered through the superior vena cava. Explanation: retrograde cerebral perfusion, RCP, is a method of delivering oxygenated blood to the brain via the superior vena cava. It is used to flush embolic debris and provide limited oxygenation during DHCA, although it is generally less effective than antegrade cerebral perfusion. During the rewarming phase after DHCA, which of the following strategies is recommended? A. Maintain gradient between blood and core temp less than 10 degrees Celsius. B. Rewarm as quickly as possible to shorten bypass time. C. Target brain temperature to exceed 39 degrees Celsius briefly. D. Ignore blood glucose levels during this phase. Answer: A. Maintain gradient between blood and core temp less than 10 degrees Celsius. Explanation: during rewarming, a slow and controlled increase in temperature is crucial. A gradient greater than 10 degrees Celsius between blood and core temperature can lead to afterdrop, cerebral hyperthermia, and worsen neurological outcomes. Which of the following is a known risk factor for poor neurologic outcome after DHCA? A. Short circulatory arrest time, less than 20 minutes. B. Use of antegrade cerebral perfusion. C. Older age. D. Deep hypothermia itself. Answer: C. Older age. Explanation: older patients are more susceptible to neurologic injury due to reduced cerebral reserve, vascular disease, and slower metabolic recovery. Age is an independent risk factor for poor neurologic outcomes after DHCA. Which of the following cardiac surgeries most commonly requires DHCA? A. Mitral valve repair. B. Descending thoracic aortic aneurysm repair. C. Aortic arch replacement. D. Coronary artery stenting. Answer: C. Aortic arch replacement. Explanation: aortic arch surgery often requires complete cessation of blood flow to allow access and repair. DHCA provides neuroprotection and enables the surgeon to work in a bloodless field safely for a limited time. Which of the following best describes the effect of DHCA on blood viscosity? A. Viscosity decreases due to enzymatic activation. B. Viscosity remains unchanged. C. Viscosity increases, potentially reducing microcirculatory flow. D. Viscosity decreases and leads to hyperdynamic circulation. Answer: C. Viscosity increases, potentially reducing microcirculatory flow. Explanation: as temperature drops, blood becomes more viscous. This can impair microcirculatory flow, which is why hematocrit levels are carefully optimized, often maintained lower, during DHCA to facilitate perfusion. In adult patients, what is the maximum generally accepted duration for DHCA without adjunct cerebral perfusion before the risk of neurologic injury rises significantly? A. 10 minutes. B. 20 minutes. C. 30 minutes. D. 45 minutes. Answer: C. 30 minutes. Explanation: most clinicians consider 30 minutes to be the upper limit for safe DHCA without adjunctive cerebral perfusion. Beyond this, neurologic injury risk increases significantly, hence selective cerebral perfusion is often added for longer durations.